Hello everyone and welcome to week 1 of Clinical Skills 2. This course really will go through several areas of the medical facility, the medical office, and specialty offices that you could end up potentially working in. For the first few weeks, it will be really more of review and looking back and touching back on skills that you learned during Clinical Skills 1. So for this week, we're going to go over chapters 7 and chapter 36. So let's go ahead and take a closer look at each of those. So chapter 7 is dealing with a ton of different topics, but the one I really want to touch base on is going to be doing telephone etiquette. So for several quarters now, you've heard and dealt with me saying that computers and electronic health records are really what you're going to be dealing with in the medical facility. They are one of the most vital key pieces of equipment that we will be using. But telephones are also a vital tool that will be used within the medical office. The key really within the medical office is to ensure that every telephone encounter you have is not only courteous, but you're also using it in an efficient, accurate, professional manner. Attention to detail is really going to be required when you're answering those telephone calls, when you're taking messages, or when you're taking refill requests for patients. Those are highly used medications, and patients need to know that they can trust you when they call in. The fundamental rule to remember when you're answering a telephone within the medical office is you don't want to answer that telephone call like you would at home. You don't pick it up and go, "Hey girl, what's up?" No, you want to do it in a more professional manner. You want to be pleasant on the phone. I know sometimes I'm a real bad one for this. If I've been in a bad mood, answering my cell phone is not always good because I don't do it in a pleasant manner. But when you're in the medical office, you have to make sure that you bring your best foot forward. So there are 5 key rules to really follow when you're answering telephones within the medical office. Number 1, you always want to smile. Smiling on the phone, acting like the patient's right there in front of you, talking to you face to face, gives a more pleasant vibe to the patient when they're answering that phone. Number 2, you want to have a good greeting. You want to answer that phone quickly, generally within 3 rings of it happening. And you want to make sure that you touch points specifically when you're doing your greeting. For example, you name the provider or the facility you work for, you give your name, and you ask how you can assist them. So for example, "Hello, thank you for calling OSF Rock Cut. This is Corey. How can I help you?" I've done all of those things. I hit the greeting, I said who I was working with, what my name was, and how can I help them. That sets a good tone for your patients when they call in. Number 3, you want to make sure you have a good speech. Now what that means is you want to make sure that you use clarity and you enunciate your words. Don't have any food or drink in your mouth either, as this ends up making your speech harder to understand, and patients don't really need that when they call in. They need to make sure that they can get to the point with the person on the phone and they get heard. Number 4, you want to identify the caller, but you want to do so by asking the patient to state their name and their date of birth. Don't ask them, "Are you Mrs. Jones?" because sometimes that gets misunderstood, and we don't need that with patients calling in. So always, after you say, "How can I assist you?" and then they say, "Oh, well, I'm a patient of Dr. Joe's and I've got this problem." "Okay, ma'am, can I have you just for safety state your name and date of birth?" And then you can pull them up within the computer system as well. And the last key piece of advice I have is to listen to your patients. Make sure that you're listening to them completely. Don't cut them off. Don't cut them short. And sometimes, I always do this at the end of the telephone call. I'll say, "Okay, so it sounds like you need XYZ. Is that correct?" Just to make sure that you understood them correctly. Alright guys, that's where I'm going to stop with chapter 7. please make sure that, as always, you read the rest of the chapter on your own. So let's switch gears now, and we're going to talk about Chapter 36. So Chapter 36 is going back and kind of touching point and focusing on assisting with the physical exam. Now, this is one of the most responsibilities that medical assistants have. We are really a part of that exam. And we're responsible for a lot of different things during that process. First and foremost, we are really responsible for preparing that exam room for the patients. What that means is that we are going to go in and we're going to clean it up before the patient gets in there. We're going to dispose of any used gowns, used table paper. We're going to wipe off and disinfect the exam table, the countertops, the computer chairs, everything that could have potentially been infected. We're going to wipe that down and disinfect it. We're going to dispose of any equipment that was used during a previous exam. Now, most equipment now is going to be a one-time use only, but if you do have any reusable items, you want to make sure that you get those to the cleaning area and start that cleaning process right away. Second thing we're really responsible for is interviewing the patient. By interviewing the patient, what we're doing is taking a complete physical history for the patient. What that means is we're going to break our health history down into 6 key items. First key item is going to be the chief complaint. What brought them into the visit today? After we get a chief complaint, we're going to ask about present illness. So what brought them in? We're going to go into more detail. We're going to get some more description on that and the symptoms that they're having. We want to know when they started, how long they've been going on, and how intense those symptoms are. Generally, this comes as a pain scale, and we always ask, on a pain scale from 1 to 10, 10 being the worst, what would you say that pain's at? Okay. After those 2 items, you're going to get a past medical history. This is going to include any history that the patient has had, such as diseases, illnesses, surgeries, or medical problems that they've experienced in the past. We'll also ask the patient about their family's medical history. We want to know, are there any health problems that are related to the patient's blood relatives that could affect them? By blood relatives, we mean mom, dad, brothers, sisters, grandparents, and aunts and uncles that are related to them by blood or by birth. We're also going to ask about some social history questions. And social history really is the lifestyle patterns that the patient has. For example, smoking, drinking, drug use outside of medications, what are their sleep habits, sexual preference, marital status, diet and exercise, and what their occupation is. All of those things could play a role in the patient's health. And then the last key piece is going to be doing a review of systems. Now, as a medical assistant, you actually do not perform the review of systems. That is done by the provider, but it's still important that you know that that is part of the documenting and interviewing that patient. As a medical assistant, you are responsible for documenting all of the information that you do receive from the patient into the medical record, and it has to be done accurately. You can't falsify any records. Also, when you're assisting with a physical exam, you might be responsible for positioning the patient. So what that means is we're going to make sure that we keep the patient's dignity and pride in mind when we're setting them up for exams. Draping is really done to help keep the patient covered and warm while still exposing the part of the body that needs to be examined. When we position a patient, that really helps aid the provider in actually doing the exam, making sure that they can see whatever it is that they need to be seeing accurately. When we talk about positioning in a patient, there are 11 different positions that medical assistants may be responsible for putting patients into. Those 11 positions are supine, dorsal recumbent, lithotomy, Fowler's, Semi-Fowler's, Prone, Sims, Knee Chest, Trendelenburg, Proctologic, and sitting positions. So those are all things that you may be responsible for doing when you're the medical assistant. One of the big things that medical assistants are responsible for during a physical exam is really assisting the physician in his exam. So as a medical assistant, you will help the physician by positioning and draping, which we've talked about, handing them instruments, handing them equipment or other medical supplies. We're responsible as medical assistants for documenting and labeling all specimens that the provider takes and making sure those get off to the laboratories correctly. We also offer assurance and comfort to the patient in times of need, especially if it's during a physical exam for a woman. Those are not very pleasant, so we as women medical assistants are there to help. We're also there if it is a male provider with a female patient. We need to be present during that vaginal exam and the breast exam. And then we're also going to help carry out any sort of treatment plans, which could be setting up medications, setting up testings, or doing any sort of immunizations. All right, so after you assist with the exam, the last two things that you get to do are, again, kind of going back to the beginning, cleaning up that exam room and taking care of the instruments that are used, making sure those get off to be cleaned and that you start the process of preparing for the next patient. All right, so that's kind of the brief overview I want to do for Chapter 7 and 36 for this week. As always, please make sure that you are reading your chapters in full. You never know when you'll see some of that information come back up on quizzes or final exams or discussion posts or written assignments. So always make sure that you are prepared for whatever may come. This week you do have one written assignment, but note that your written assignment is actually in two parts. Both parts need to be put into a zip file or zip folder and submitted as one submission. So please make sure that you're paying attention to those instructions when you are doing your assignment this week. So part one of your assignment, you're really going to describe how you will establish a connection with your patients and how you will handle any sensitive topics that come up. These are generally things that come up during that social history interaction. Part two, you will need to download the table analysis worksheet that can be found in Angel and answer the questions that accompany it. Please make sure that you submit your assignment by Sunday at midnight because that is the due date for that. If you're looking for how I'll be grading that, if you head over to the calendar, I do have a description again of what your assignment is and the rubric I will be using to grade you with. Also this week you have one discussion post, and your discussion post is surrounding the topic of chief complaints. You will need to explain why and how obtaining a thorough chief complaint can really assist you and the provider and help you become prepared for that provider. Know what his needs are. Know what he or she will need during that exam. Please note that your initial discussion post is going to be due Tuesday by midnight, and your two responses are going to be due Saturday by midnight. Please make sure that these responses are to your classmates, and make sure you're putting in good thought and effort to your responses, just like you do your initial discussion post. All right, guys, I look forward to seeing you all on Tuesday. Have a wonderful week, and welcome back to another quarter here at Rasmussen College.